Hello, hello. I am here with Ben Hoff, who is going to be teaching a class on working with Chemsex. Thanks for being here, Ben. I really appreciate it. Tell me, what is Chemsex?
Chemsex is quite a complex presentation. It's essentially sexualized use of it's normally associated with three types of drugs. So crystal methamphetamine, GHB, GBL, and methadone.
Okay. And,
Yeah.
and so when we talk about working with Chemsex, what are we going to learn in this class?
Chemsex, as I said, it's quite a tricky presentation because on the one hand, you're kind of needing to look at and treat substance use, and on the other, aspects of compulsive sexual behavior. And also know about the interplay between the two things.
Okay.
And what I kind of noticed is quite a lot of the guys that I work with, they've maybe had quite a bit of support around the substance use side of things, much less so a lot of asymmetry in treatment around the sexually compulsive behavior aspect of things, which is either ignored completely, or it's treated as if it were an addiction. And as we know, DSM-5 and the ICD-11 and ASECT are very clear on this, that they're not the same things. So um, I'm going to be teaching a 2-hour workshop, which is looking actually at a mindfulness-based approach to working with chemsex behaviors. And the reason for that is mindfulness-based approach dovetails quite well with this presentation because it takes a middle way. So it encourages non-judgmental observation and acceptance of experience. It discourages attachment to subjective labels like addict. It also foregrounds insight, understanding, and choice over abstinence, which may or may not be a treatment goal for participants. Certainly, for a lot of participants, their goal is not abstinence from sex. And mindfulness is also at the heart of many of the practices that we suggest for clients in sex therapy to strengthen their sexual connection with themselves and others. So the two are quite natural bedfellows, so to speak.
And so for a lot of people, they're using the drugs to have better sex or to fuel kind of, their sexual behavior, correct?
Yeah, it's the combination of these drugs, and not all men use the same, may not use all of the drugs when they're having sex, and they may supplement with other recreational drugs as well. But essentially, to boil it down, they increase sexual arousal whilst also decreasing sexual inhibition. So we'll be talking in the training also just in terms of etiology and underlying factors, particularly the relevance here of minority stress. Using chems often as a an antidote to shame, but also something that really facilitates for a lot of guys extremely, a lot of peak sexual experience, which can be really affirming. That's often can get lost in treatment. Therapists can encourage people to stop their behaviors without really understanding actually what the function of them is. And also, if a client has decided that they want to move away from chemsex behaviors, there's going to be a process of grief because actually, whilst at this present moment in time when they appear at the therapist, they may be causing a lot more costs and benefits. Actually, at the outset, there's often they perform quite an important role in terms of sexual connection with themselves, with other people, antidote to loneliness in some cities, etc. So we'll really be sort of wanting to understand, what the allure is, why are these so compelling, and why do some guys, find it so difficult to stop using them?
Yeah, and it's interesting because a lot of times when you work with, sort of any presenting issue, and there are drugs or alcohol involved, the sort of, train of thought is, well, we have to stop the drug use and the alcohol and, substance use before we can touch on this. But in this situation, we're kind of approaching them together. Is that correct?
Yeah, that's right. And actually, I think even with clients that I work with who are not struggling with chemsex, but maybe just substance use, like the impulse clients, they arrive for therapy and they want to move forward, right? And sometimes it can be like, I'm never gonna use again. And actually, by either sort of within services who insist on abstinence before they'll even start treatment, or clients themselves imposing that, I think we're kind of losing some really valuable learning opportunities, particularly with chemsex, like the process of observing and looking really at the interplay of triggers, cravings, and the moment by moment experience of how things unfold. If somebody is already sober, we don't have those very recent experiences to learn from. Obviously, I'm caveating this that clients need to be reasonably stabilized to be able to engage in a therapeutic relationship and work safely.
Right. Interesting. And so is this more common in the LGBTQIA population? Is that sort of
Chemsex, I mean, there is a little bit of debate on this about whether we can now use the term to refer to opposite gendered couples who may use drugs in a group setting to facilitate sexual experience. I think the consensus still is that chemsex is still a word that we would use primarily in relation to men who have sex with men, because the underlying factors and background context is very specific to that particular demographic. That is not to say that there are not also people who, of other sexual orientations who are using the same drugs to facilitate sexual experience. But I think at the moment, we would still use that term specifically in relation to men who have sex with men.
And so you gave us a lot of information. Any like teaser you want to give us before we wrap up in terms of what people can get excited about?
Yeah, I mean, I think whether you're somebody who already, already works in this area and has a lot of experience, or somebody who has absolutely no idea what chemsex is but wants to learn more, there will be something for everyone in this, in the sense of if you're very experienced with this, this may give you a new angle, a different approach to try with some clients. And if you're new to this, then hopefully this will give you a good introduction, which is sexologically informed, whilst also addressing the absence of substance use. And I'll be leading participants through at least one, possibly two meditations, so that by the end of the session, you have something in your back pocket to be able to suggest to clients to support them in their recovery.
I'm so excited. Thank you so much and can't wait just for the class.
Yeah, really looking forward to meeting everybody. Thank you.